Dr. Corey Moss on Looking Your Best. I wanted to spend a few minutes today to talk about a new technology, Ulthera. Ulthera is an ultrasound device that has been cleared by the FDA for actually doing lifting using a non-invasive technology. It's the first and only device in the United States that's gotten a clearance from the FDA for lifting, and you will see actually in some photographs that we'll post here on the blog, and also some demonstrations if you view my website at mossclinic.com, some very good examples of actual lifting improvement that is achieved by using ultrasound. Now I want to talk a little bit about how the technology works and then contrast it against some of the other technologies that have made some claims about lifting but are really devices cleared for mid-skin tightening. So these technologies I wanted to describe graphically and how they work, and I'll focus in on Ulthera in just a second. But if you can imagine this as being the skin surface and subcutaneous tissues. Here's the surface here, the epidermal layer, the subdermal or the dermal layer here, and the subdermal layer immediately below that. You can see the little fat globules here and the fibrous tissue bands that are part of the fascia that belong down below here, which is the brown line. And the fascial layer is there in most areas of the face. So again, it goes skin surface, epidermis, the dermal layer, which is very important. That's where collagen and elastin and hyaluronic acid reside, sort of the ground substance of the skin. The subdermal layer, which includes fat, fascial bands, and then a very thick connective tissue layer, the fascial area, like the SMAS in the face, the so-called subcutaneous musculoaponeurotic system. When we do laser skin resurfacing, as can be described here, in a fractional way, what we're doing is creating little thermal injuries that go through the epidermal layer and into the second layer of the dermis, and depending on heating that can go all the way through. That's why we're very careful, and it's a selective injury, and lasers work on the skin surface only. They do smoothing, a great job at fine lines and wrinkles, contour and texture. So that's where that category of energy delivery device for the skin is. The next category of skin injury device, and actually you could include in this area chemical peels, or even full laser resurfacing or dermabrasion, in which case you wouldn't see little lines of thermal injury like you see represented by these little triangles. You'd actually see the full layer here of skin being gone, and how that rehabilitates itself or recovers is by migration of new skin cells from the adnexal tissues below the skin, which are the oil and sweat glands and hair follicles, etc., and reepithelialization and new skin over the surface. Fractional laser is different in that it heals much faster, and we've talked about that in other of our sessions. The next type of technology, which is most interesting, and I really believe it has a good applications in many of the things we do, is radio frequency or electrical energy, basically, that's being delivered to the skin and tissues below the skin surface. And there are many devices, one of which we have, the VeloShape 3, which is the newest of them from Syneron. There's a handful of devices that include RF. Probably the most well-known is Thermage. And when Thermage first came out, of course it's improved a lot now. It's grounded distally with a little grounding pad, and there's a surface treatment handle that's placed on the skin surface, and with that electricity is passed through the skin, and the skin acts as a resistor with the fat and skin cells creating impedance. And whenever there's a resistor and impedance to electrical energy flow, there's heat built up, and you can see it's built up near the skin surface, the yellow where it's hottest, green less heat, and then down lower the least amount of heat. So what we're seeing with VeloShape and Thermage and the radio frequency devices is gentle heating, and this is all controlled based on the energy level set and the operator using it, down to and including maybe the top, maybe through the dermis, and in some cases we think we can get subdermal. There's a lot of energy delivery that's done this way. I think we can see general skin tightening, and some contour improvement is seen also, particularly with these new devices, but there is really need for further research in terms of how much contouring we can actually get. Sort of excited about what we'll be able to see with the new VeloShape 3 device, getting the tissues up to 42, 43C. With Thermage, they're actually getting up into the 50-some degree range here and causing skin tissue tightening. Now, how much contouring it gets, that's another question, and I'll leave that for a further discussion at another point. The last of these technologies, Ulthera, uses ultrasound energy, and those are literally sound waves, high-frequency sound waves that are delivered through the skin surface, and based on the tip that's being used, or the transducer on the end, you can lay the ultrasound energy really at the fascial layer, 4 to 5 millimeters below the skin surface, at the junction between the subcutaneous tissue and the dermis at about 3 or 4 millimeters, and then much nearer the skin surface, if we want to do fine lines, at about 1.5 millimeters. There's a small handpiece that's applied to the skin surface. Typically patients get very small amounts of anesthesia with this, and those energy delivery, depending on the handpiece, would lay little rows or dots and contour along the lower face, neck, and even brow area. It's just showing what it would be if it was a 4.5 millimeter transducer. These little dots representing a 3 millimeter transducer if you were targeting those areas. But for general contouring, we're primarily using this 4.5 millimeter transducer to get improvement in contour. So Ultherapy, I think, represents a significant technological advance in the area of facial contouring. This is a procedure that's often offered in the office with no downtime. There's no injury whatsoever to the skin surface when it's properly performed. It has minimal discomfort, and we have a whole protocol for people who are a little sensitive with doing very light skin blocks, so they'll feel absolutely nothing. The company actually just recommends ibuprofen, but we want to make sure it's a totally comfortable procedure. If you're reading about it and you've seen where it's uncomfortable, where those patients haven't been offered a blocking alternative, which I think doing a small local anesthesia block is so simple and easy that for anybody that is a little sensitive, that's easy to do. We're seeing really good results. It's certainly not a facelift, and I don't ever think it should be marketed as a replacement for facelift, but for people who are younger, in their 40s, their late 30s even, with sun damage, or people who have already had a lift and just need a little tightening, Ulthera may very well be the best option for them. If you have any questions about Ulthera, again, I encourage you to visit our website at mostclinic.com. There are before and after pictures there, as well as a detailed explanation of how the technology works. Or visit our blog. I'm open to any questions you have. You can visit the blog site, send me photos, videos, or written questions, and we're happy to talk about it. And as always, Dr. Corey Moss on Looking Your Best.